REVASCAT was one of the 5 randomized trials in acute endovascular stroke. They were published in the New England Journal of Medicine within a space of a couple of months, and have revolutionized the field of acute ischemic stroke due to large vessel occlusion. REVASCAT was a randomized trial that used a single device, Solitaire, against best medical therapy, which included intravenous TPA in eligible patients up to 8 hours of symptoms onset. And the study was positive. It showed significant benefit of embolectomy across all states of disability with a very reasonable safety profile. What set apart REVASCAT from the other 4 studies that were published was that REVASCAT was a population-based study. It took place in Catalonia, Spain, which has a very sophisticated stroke care system, and almost the entire population that comprises Catalonia was basically included in the study. Drew from this almost entire population, and there were very few patients who were treated outside of the trial, so there was pretty much almost consecutive enrollment, which again validates that this procedure is effective even when applied to populations rather than hand-picked selected centers. I think right now we're more and more moving towards the concept that there is no collective time window, that there is only an individual time window, that every person has their own time window. Of course, the faster you treat the patient, the higher the chance of a good outcome. We chose 8 hours because a lot of the preceding studies, the single-arm studies, were conducted within 8 hours. But the key is to not take all comers within 8 hours, but select them so that you only consider for treatment patients who have a relatively small infarct. Because if the patient has a large infarct and you open up the vessel, there will not be any benefit, and there will be a lot more harm. So time windows are something that are still contested. What exact time window is? I think that most of the evidence we have, including in REVASCAT, most patients were treated within 6 hours. 2 of the 5 studies went out to beyond 6 hours. REVASCAT 8 hours, and ESCAPE up to 12 hours, but only a minority of patients were treated in this more prolonged time window. The jury is still out whether this procedure is beneficial in the more prolonged time window. We think that that's the case in very selected patients, but that remains to still be proven. There is a randomized trial going on and that seeks to address this question. And REVASCAT, just like all the other trials, has shown that the faster you open up the vessel, the higher the chance of a good outcome. That doesn't mean that there aren't patients who could benefit from intervention even in the prolonged time window.